Let's be clear. Regular medical checkups save lives. But after age 70, some health screenings can quietly shift from helpful to harmful, triggering unnecessary anxiety, invasive treatments, or even life-threatening complications. That's the uncomfortable truth we're unpacking today. Welcome to Seniors Vitality Hub, your trusted channel for smart, senior-focused health advice. If you're over 70 or caring for someone who is, this video could change the way you approach health forever. First, thank you for spending your time with us. We know your health decisions are deeply personal. That's why this video is packed with evidence-based insights in clear tone designed to help you and your loved ones avoid unnecessary tests and focus on what truly matters at this stage of life. Today, we'll expose 5 health checkups that seniors over 70 are better off skipping, tests that many still undergo without realizing the risks may outweigh the benefits. And we're not just pointing out problems. We'll also share safer, smarter alternatives that protect your health without the extra burden. If you're serious about aging well, take a moment to like this video, subscribe to our channel, and tap the bell so you never miss a wellness tip designed for the golden years. And if you know someone facing a pile of routine tests, share this with them. It might just save them a hospital trip. Let's start with the first checkup you should think twice about after 70. It's more common than you think, and its risks are often overlooked. At first glance, getting a full-body CT scan sounds smart. After all, it promises to catch hidden problems before they get worse. But for seniors over 70, this popular peace-of-mind checkup can actually do more harm than good. Let's break it down. Full-body CT scans expose your body to significant amounts of radiation, the kind that can quietly increase your long-term risk for cancer, tissue damage, and kidney issues, especially when done yearly or without symptoms. And because the scan captures every inch of your internal anatomy, it often reveals incidental findings, small spots, shadows, or changes that look suspicious but are completely harmless. These incidentalomas, as doctors call them, lead to extra tests, biopsies, and even surgeries that could have been avoided. For seniors, that can mean weeks of stress, invasive procedures, and exposure to more risks, all to chase something that may never have become a problem in the first place. Take Mr. Turner, 74 years old. His scan showed a tiny lung nodule, likely scar tissue, but the follow-up tests snowballed. Chest biopsies, painful waiting periods, and ultimately an unnecessary surgery. The result? Months of recovery for something that was never dangerous. What's the smarter alternative? Instead of a full-body CT, just to be safe, work with your doctor to focus on symptom-based screening and evidence-based guidelines. If you feel fine, and your medical history doesn't suggest high risk, there's no need to go hunting for problems that might not exist. Remember, early detection is only helpful when it leads to better outcomes. And in this case, the risk of false alarms can do more harm than good. Up next, a very common cancer screening that many older men are still getting, even though top experts now say they shouldn't. It's one of the most commonly promoted tests for men, the PSA test, short for prostate-specific antigen. For years, doctors recommended it as a routine part of men's health. But for men over 70, this test may actually cause more trouble than it prevents. Here's why. The PSA test measures the level of a protein produced by the prostate. Higher levels could mean cancer, But they can also mean benign conditions like an enlarged prostate or a simple infection. In older men, these non-cancerous causes are extremely common, so the test can easily give false alarms. And when the result is abnormal, the follow-up is rarely simple. It often leads to biopsies, MRIs, or even surgery. Procedures that come with risks like bleeding, infection, incontinence, and sexual dysfunction. Worst of all, many of the cancers found in seniors through PSA testing are so slow-growing they would never have caused problems during their lifetime. Take Mr. Langston, age 76. His slightly elevated PSA level prompted a biopsy. He was diagnosed with a low-risk cancer and chose surgery out of fear. The cancer wasn't life-threatening, but the complications from surgery left him with chronic urinary issues that changed his quality of life. So what should you do instead? Most experts, including the U.S. Preventive Services Task Force, recommend against routine PSA screening after age 70, especially if you're symptom-free. Instead, pay attention to warning signs: difficulty urinating, blood in urine, or pelvic discomfort. Only then should testing be considered. The bottom line? Testing without symptoms isn't prevention. It's guesswork. And at this age, guesswork can lead you down a path you never needed to walk. Coming up, the test that's supposed to help protect your memory, but could actually put your peace of mind at risk. For many seniors, one of the greatest fears is losing memory or developing dementia. So, it's understandable that when a doctor suggests a brain scan or memory screening, just to be safe, most people agree. But here's what you might not hear often. Getting cognitive testing or brain imaging without real symptoms can be more harmful than helpful. Here's why. As we age, the brain naturally changes. Small shifts in structure, like mild shrinkage or white matter spots, are incredibly common and usually harmless. But when a senior without memory complaints undergoes an MRI or cognitive test, these normal changes can be misinterpreted as the early signs of Alzheimer's or dementia. And that's where the problems start. A false or premature diagnosis can lead to emotional distress, unnecessary medications, and even social withdrawal. It can also place a heavy burden on caregivers, who begin adjusting lifestyles around a condition that may not even exist. Let's talk about Mrs. Elaine, age 78. She was perfectly functional, managing her bills, enjoying book clubs, and still driving. But her son pushed for memory screening after she forgot a dentist appointment. The scan showed mild brain changes. Her doctor suggested early dementia. Overnight, her world shifted. Her independence, confidence, and routines all crumbled. 3 years later, she's still sharp, but still recovering from the emotional hit. The better path? If you're not experiencing noticeable memory decline, like forgetting names of close relatives or getting lost in familiar places, there's no need to scan your brain or take cognitive tests. Instead, support your brain naturally with regular social interaction, mental stimulation, exercise, and good sleep. Remember, not every forgetful moment is a warning sign, and not every test brings clarity. Sometimes, protecting your mind means knowing when to say no. Colonoscopies are an important tool for detecting colon cancer. But after age 75, they can become more harmful than helpful. Many seniors agree to repeat screenings out of habit or fear. But here's the truth. If you've had normal results in the past, you may not need another colonoscopy again. So why is it a problem? Colonoscopies are invasive. They require strong sedatives, intense bowel preparation, and carry a much higher risk of complications in older adults. These include bleeding, colon perforation, irregular heart rhythms, and even post-procedure infections. For a younger adult, recovery is usually easy. But for seniors over 75, the body doesn't bounce back the same way. Let's look at Mr. Howard, age 79. He had a clean colonoscopy at 70, but agreed to another one, just to be safe. During the procedure, a tiny tear occurred in his colon wall. It led to a dangerous infection that landed him in the hospital for nearly 2 weeks. And the kicker? No cancer was found again. The science says colorectal cancer develops very slowly, often over 10 to 15 years. So if you've had one or more clear results before age 75 and aren't experiencing symptoms, the chance of finding something dangerous is extremely low. The potential harm from the procedure often outweighs the benefit. Better alternatives? If your doctor still wants to check for colon cancer, ask about non-invasive options like the FIT, fecal immunochemical test, or Cologuard. These are safer and easier for seniors and can detect blood or DNA markers in stool without putting your body at risk. Bottom line, smart screening is age-sensitive. After 75, it's about protecting your quality of life, not chasing problems that don't exist. It's a standard part of many checkups, the thyroid test. Doctors often run it without even asking, and most seniors don't think twice. But here's what you need to know. If you're over 70 and not showing any symptoms, routine thyroid testing could do more harm than good. Here's why. As we age, TSH, thyroid-stimulating hormone, levels naturally rise. It's a normal part of the aging process, not necessarily a sign of thyroid disease. But when doctors see these slightly elevated levels, they often rush to prescribe thyroid medication, assuming hypothyroidism. The problem? Treating a number on a lab report without actual symptoms can cause serious issues. Many older adults placed on thyroid medication experience heart palpitations, anxiety, muscle weakness, sleep disturbances, and even bone loss. That's because overmedication can push the body into hyperthyroidism, which increases the risk of fractures and cardiac problems in seniors. Take Mrs. Carroll, 82, who felt perfectly fine. Her routine blood work showed a mildly high TSH. Her doctor prescribed thyroid pills immediately. Within weeks, she was jittery, couldn't sleep, and developed an irregular heartbeat. She later learned she likely never needed treatment at all. What's the safer approach? If you're not experiencing symptoms like unexplained fatigue, weight gain, dry skin, cold sensitivity, or depression, then there's no urgent need for a thyroid test. Good doctors will treat the patient, not just the lab result. Instead of default testing, have an honest conversation with your healthcare provider. Ask, is this test necessary based on how I feel? If the answer is no, it's okay to skip it. Remember, in senior care, less is often more. Smart medicine isn't about doing more tests. It's about doing the right ones at the right time. Let's take a moment to breathe. If today's video made you feel surprised, maybe even a little uneasy, that's completely understandable. For decades, we've been taught that more tests mean better care. But after 70, that rule often flips, and blindly continuing routine screenings can invite more harm than healing. Let's quickly recap what we've uncovered. Full-body CT scans expose you to unnecessary radiation and often trigger a cascade of false alarms. PSA tests in older men frequently lead to treatments for cancers that never needed to be treated. Memory scans without symptoms can label you too soon, steal your peace, and lead to unnecessary medications. Colonoscopies past 75 carry real risks without much added benefit if you've already had clear results. And routine thyroid tests can lead to overmedication that does more damage than the mild changes it was meant to treat. Now, this doesn't mean you should ignore your health or skip every test. It means you deserve care that's thoughtful, tailored, and age-appropriate. The goal in your 70s and beyond isn't just detection. It's preservation of your quality of life. Here's what you can do next. Talk with your doctor. Ask, is this test really necessary for someone my age with my history? Get a second opinion if something doesn't feel right. And most importantly, be your own advocate. You have wisdom and now, information to guide you. Now, let me ask you which of the medical procedures have done in the past, and what was your experience? Thank you for watching and being part of the Seniors Vitality Hub community. If this video opened your eyes or gave you confidence to ask better questions, please like this video. Subscribe for more no-nonsense senior wellness tips every week. Share this with a friend or family member. It could save them from an unnecessary health scare. Until next time, stay strong, stay informed, and trust your instincts. You've earned the right to age on your terms.